Well, welcome everybody. Hello, and welcome to the Congressional briefing on the landmark bipartisan Community Mental Wellness and Resilience Act of 2023. Now, almost 1,300 people from all sectors of society and from almost every state in the U.S. have registered for this briefing, and we welcome you all. My name is Bob Doppelt, and I coordinate the International Transformational Resilience Coalition, or ITRC for short. We're a network of mental health, social work, human services, and other organizations working to prevent and heal the mental health, behavioral health, and psychosocial impacts generated by rising toxic stresses, emergencies, and disasters. Before we begin the material, I want to give a special thanks to the organizational co-sponsors of the briefing that you can see their logos on the introductory slide here. Many of them are members of the ITRC National Steering Committee, and you will hear from many of them today, as well as many others. So thank you for co-sponsoring this. And also I want to give a thank you to the Congressional Social Work Caucus for co-sponsoring the briefing. Even before the COVID-19 pandemic, psychological and emotional distresses and traumas were accelerating nationwide. And the pandemic, as we all know, made them far worse, more visible, and now impossible to ignore. Today, many accelerating personal, social, economic, and environmental traumatic stresses, including toxic social isolation and loneliness, income struggles, and much more, have produced widespread adverse mental health and psychosocial conditions. The record heat waves, rain and windstorms, floods, drought, wildfires, dangerous smoke events, and other emergencies and disasters Americans are experiencing are aggravating the existing stresses and traumas and adding many new ones that impact millions more people. The result is what can be called nothing other than an epidemic, a national epidemic of psychological, emotional, behavioral, and psychosocial conditions. And as disturbing as they are for the individual, the consequences often go far beyond what an individual experiences. Many distressed and traumatized people try to self-medicate by using drugs, alcohol, or other methods and end up harming themselves or their families or the public. Others turn their distress outward and become aggressive or violent towards their spouses or children or towards other people, and they can traumatize the entire community. And stressed and traumatized people often experience job difficulties, which affects their income and employability, and also affects their employers and the economy as a whole. So indeed, as we are seeing across the US, no other health issue comes close to creating the wide range of individual, family, community, social, and economic woes as mental health and psychosocial struggles. Today's mental health epidemic must be considered a public health emergency because at different times, in different ways, different magnitudes, everyone can be affected. And without a significant expansion of the way we approach the issues, the traumas will only grow worse as more stresses and disasters occur. To date, our primary response to these challenges has been to expand our behavioral health systems. And while this is very important, behavioral health services do not prevent mental health problems, and there will never be enough providers to assist all of the people who experience mental health or psychosocial conditions. We therefore need to expand the US approach to mental health by actively engaging communities in strengthening the capacity for mental wellness resilience of their residents to prevent and heal traumas caused by all types of adversities. Fortunately, a number of initiatives around the US show how this can be done, and you're going to hear from some of them today. They and other initiatives around the US show that community is medicine. Done well with the right support, right engagement, and funding, community can be medicine. One of the issues almost every community initiative that deals with these issues struggles with is funding to get organized, as well as funding to support and grow their operations and strengthen how they're doing their work. And this is what HR 3073, the Community Mental Wellness and Resilience Act of 2023, will address. So I want to give our sincerest thanks to Congressman Paul Tonko for seeing the need and developing and introducing this very important legislation, and thanks to his staff for all the work they've done. And you're going to hear from Representative Tonko in a second. I also want to give thanks, however, to Representative Don Bacon, who's also with us today, as well as Representatives Brian Fitzpatrick, Mary Peltola, and Kathy Castor for being original co-sponsors of the House bill. And I want to give thanks to Senator Ed Markey, Jeff Merkley, and Richard Blumenthal for introducing S1452, the companion bill in the Senate. So with that, I would like to turn it over to Representative Tonko to have the Congressman say some words about this. Thank you again, Congressman, for introducing this bill, and we look forward to your comments.
Well, thank you, Bob. I appreciate your great work with ITRC and the great impact that it has, and I certainly appreciate with great gratitude the invitation for today's gathering and your tireless dedication to these issues, which is so important. And it's great to be joined by my colleague, Representative Bacon. So together, let's hope we can get some bipartisan, bicameral work done, which will assist everybody in the process. I also want to thank all the experts here today. I noticed there's an awful lot of co-sponsors, which is terrific for the event, and want to thank all the experts here today to share the critical work they are doing that promotes quality of life and really responds to efforts that are made for individuals with dignity. So I appreciate that factor, those components. And thank also my colleagues in Congress for supporting the Community Mental Wellness and Resilience Act. Just last week, communities across New York and the Northeast, New England, had experienced torrential downpours and catastrophic flooding. Some historic measures, in fact, that were realized. This week, these same communities were faced with poor air quality driven by wildfire smoke. This is not a unique story. Communities across the United States are hurting from the onslaught of extreme weather events that are only increasing in frequency and severity. In 2021, more than 40% of Americans lived in a county impacted by a major natural disaster. These events are taking lives and livelihoods and leaving deep emotional scars in their aftermath. Studies have shown that up to 40% of those living in affected areas experience trauma as a result. To ensure a healthier and more sustainable future for all, we must respond to and help prevent the mental health challenges that people face during and certainly after disasters. That is why I'm proud to have introduced the Bipartisan Community Mental Wellness and Resilience Act, and to be working with my colleagues in Congress across the aisle, down the hall, to help address our nation's mental health crisis head on. My bill would establish a pilot grant program through the Center for Disease Control and Prevention to support community-led initiatives to build mental wellness and resilience. Work to improve community resilience goes beyond only supporting disaster preparedness and one-on-one mental health treatment to include all factors that impact overall health and mental wellness, like strengthening social connections. By adopting a long-term and holistic approach focused on building resilient communities, we can actively reduce the negative mental health impacts of future disasters and aid in the healing process for those affected by given traumas. Central to my bill is the funding and support of community-based resilience coordinating networks. Nobody understands the unique needs of a community better than those who call it home. And that's the basic epicenter of our thinking with this legislation. Empowering local groups with the necessary resources to drive their own prevention and healing efforts is not only helpful, it's crucial. Moving forward, I'm hopeful that we can continue to work together to strengthen our communities. We must meet this moment and lay the foundation for a society that not only survives, but thrives in the face of adversity. We have seen by example that these are necessary services. We have seen the impact on the quality of lives of people, and to be able to put together a grant opportunity, to be able to have resources to develop the community response and plan of action indeed are critical factors. I promise to continue to do my part in working to deliver science-based, evidence-informed solutions that benefit communities across our great nation and offer an holistic response to natural disasters, toxic stresses, and the ongoing climate crises. Thank you all again for being here today. Your dedication and collective efforts give me hope for a more resilient and healthier future for all Americans. By working together, we can get this legislation passed, we can get it up and running, and implement it in a way that will really produce a difference, a major difference in how we can respond as a nation via the many communities that we all call home. So with that, thank you for the opportunity to be with you today. And Bob, again, I appreciate your great work with ITRC.
Thank you, Congressman. And again, thank you for designing and introducing this bill and for joining us today. It's a great honor. And now I'd like to actually introduce Congressman Don Bacon from Nebraska. It's also an honor to have you here today. Thank you very much for joining us. And let's turn it over to you for a few minutes.
Well, thank you, Bob. And I really appreciate your opening comments. I thought you did a great job. It's hard to do better than what you already did. And Mr. Taco as well did a great job summarizing the bill. Maybe just real quickly on my background, I take mental health. I like to call it brain health. I think brain health may even be a better term because a lot of what we see is physical in nature, but so it's also trauma. And we don't want to treat mental health differently than we do other types of illnesses out there because I think it probably stigmatizes folks trying to seek help. But so sometimes it's called brain health. But I've seen this in my own life. When I was young, I had no idea what mental health or brain health was all about. But my dad remarried, and I just remember being a teenager, seeing my stepmom really undergoing going through this, where she had cycles of violence and just terrible things. And I had to come to grips with what's this all about. So that was me as a teenager. Then I commanded 5 times in the Air Force. And I saw a lot of individuals going through these struggles. And so it's made me serious. And what I've realized when you look backwards, the United States cut mental health care significantly 2 or 3 decades ago. And we took a lot of money out of the inpatient care and never went anywhere. We've done a very poor job putting in outpatient care. So we have a deficiency here, clearly, in our country that we got to work on. And I think Paul did a great job talking about this bill, but let me just read a couple of lines. So just to put everybody on the same sheet of music, this bill appropriates funds for the fiscal years 2023 through 2027 to fund small planning grants to help community resilience building initiatives get organized, and larger program grants for up to 4 years to strengthen and help expand community mental wellness and resilient initiatives. 20% of this money is reserved for rural areas. And why is this so necessary right now? We see about a 30% increase in our high school youth having brain health problems. 30% increase. I want to come back on some thoughts on why that may be, but the fact is we're seeing this increase. We got to deal with it. So I've been supporting initiatives to put more healthcare providers in our schools so they can treat people right there on the spot and give them the support they need. We're expanding, having these behavioral health doctors in our children's hospitals. We have a great children's hospital in Omaha, and they're opening a brand new center here soon just for behavioral health. We're expanding funding in our community health centers, for example. So we got to do this all along the line. Our VAs, we're putting a lot more money in our VAs. So there's a huge need here, but we're specifically seeing it with our youth, with about a 30% increase. And so one of the challenges here, we don't have enough workers. So we got to figure out, how do we help fund more specialists that know how to help our kids here? So these grants will help offset or help fill that need as well. And so one of the comments I have written down here is just to focus what this does. It puts more power at the community level. These grants will help communities with good ideas. I got to tell you, the federal government doesn't have all the great ideas, but when a community has a good idea how to support our high schools better or our youth, whatever it may be, these grants will help fund those initiatives. And so in this case, we're saying community is medicine. A strong community is medicine. A strong community can help treat folks who are struggling in this area. And I believe that as a federalist, which I am, helping communities deal with this with their innovation and on the ground knowledge of their community, if we can help them succeed, that's what this bill is trying to do. Let me just close on a thought. I go to a lot of high schools. I do town halls in our high schools, and I'll ask them. I'll point out there's this 30% increase. I ask them why. One of the things that come across to me is a lot of our youth today do not have hope or meaning, and it's pretty profound if you think about it. I know I get my hope and meaning from my faith primarily, but everybody has to figure out how they get their hope and meaning. But when you talk to a lot of these youth, there is not a sense of why am I here? What is my meaning? And a lot of them, and I've heard it verbatim, I don't have hope because I believe our world is going to be destroyed in 20 and 30 years. I hear this. So imagine being an 18-year-old, 17-year-old, 16, whatever age, and you think the world is going to be destroyed in 20, 30 years because of climate change, and you don't have any meaning. This is what our youth are dealing with. And we got to figure out a better way to respond to this, because I think it's all right to talk about what we got to do to make our planet safer, cleaner, and to help protect our earth. But we also got to give our youth hope in this as well. So I just put that on the table. It's a lengthy discussion, but I only speak this because I ask our kids in our high schools, and this is what I'm hearing. And so with that, I yield back, Bob. I really appreciate your time, and I thank Paul for leading this effort.
Well, thank you, Congressman, and thank you both again, Representative Tonko and Representative Bacon, for your leadership in this really important bill. I'm going to open my screens again, and I'm just going to spend a few minutes now describing in more detail. Representative Bacon and Tonko just described the bill, but I really want to talk in depth, and then you're going to hear for the rest of the session from people in the field working on these issues. As I said earlier, and I think you just heard from both congressmen, we're really facing an epidemic of mental health and psychosocial issues. And the noted clinical psychologist George Albee once said, "No epidemic has ever been resolved by paying attention to the treatment of the affected individual." This is a psychologist saying this, not a disease specialist. So this applies to mental health issues. And so to address today's mental health epidemic and prevent future ones, we've got to expand today's approach to mental health by embracing a public health approach to mental wellness and resilience. A public health approach to mental wellness and resilience focuses on the entire population, not just individuals with symptoms of pathology or high-risk groups, vulnerable groups, although they must be included using what's called proportionate universalism and life course approaches. So everybody's involved, although there's different interventions for different groups. We must leave no one behind in this effort. A public health approach to mental wellness and resilience prioritizes preventing mental health problems before they occur, not merely reacting to or treating them after they emerge. And it integrates group and community-minded healing methods into the prevention strategy, because the prevention can also help people heal. So we always have to remember that prevention is the cure. And it accomplishes those goals by strengthening protective factors, social supports, resilience skills, habits, local resources that build and sustain healthy thinking, behaviors, and responses, not just trying to treat deficits or fix deficits or treat symptoms of pathology. So we must build strength and resources. Research and ample experience, as you'll hear from many people in a few minutes, shows that mental wellness and resilience can be enhanced. We know, and mental health problems can be prevented and healed. And that the most effective way to do that is to establish the social infrastructure in communities that you can call a resilience coordinating network. Some call it resilience task forces, resilience boards, many different names. You can call them resilience coordinating networks that engages a broad and diverse array of local residents, civic groups, nonprofit, private, and public organizations in planning and implementing and continually improving locally chosen and tailored strategies that strengthen the capacity of their residents for mental wellness and resilience. Here's a sample resilience coordinating network, and there's all sorts of variations on this, but you can see in the middle, there's a steering committee or board of directors or task force, whatever they call it. They often have chairs or co-chairs, and if they're lucky, they have a 1 or 2 staff. And around as participants, you can see, I'll start at the upper top. They might be neighborhood leaders, private sector leaders, civic leaders, the YMCA, et cetera, youth leaders, public sector leaders, mental health and human services, nonprofit, faith leaders. Every steering committee or board is going to be different, composed of different folks. But that's just an idea. But then often outside of that are groups that are working with different populations. So again, starting up at the upper right hand, there might be groups working with neighborhood groups, with the private sector, with youth and child innovation team, with education, the public schools, private schools, public sector, healthcare teams, emergency management and public safety teams, community leaders. They are all developing their own strategies and working with their populations, but they come back and they stay very well coordinated strategy-wise. They share what they're doing, they get feedback, they identify gaps in populations that are being served, et cetera, et cetera. This is really what we see going on around the country, and there's lots of variations of this. We completed about 2.5 years of intensive research into how to help build population level capacity for mental wellness and resilience. And this included looking all over the US and internationally. And we found 5 core foundational areas that really need to be addressed or will benefit everybody by addressing to build that mental wellness and resilience. And by far the most important we found is to build social connections across cultural, economic, and geographic boundaries in the community. There's lots of exciting programs out there, community programs that are doing this in very different ways. It's often called building, bonding, bridging, and linking social support networks. It happens just by bringing those resilience coordinating networks together and helping people get to know each other, but also at just engaging the residents and around the community to get to know each other. The second is to foster universal literacy about mental wellness and resilience. This builds on health literacy. The starting point is to help everyone become trauma-informed, help people understand how trauma and toxic stress can affect their body, mind, emotions, and behaviors, as well as the emotions and behaviors of groups. And then also learn what we call simple self-administrable presencing skills, which calms the nervous system when people are distressed, their self-regulation skills, and purposing skills, which could be called adversity-based growth skills. It's how to use adversities to learn, grow, and find new meaning, purpose, and hope and courage in life. The third foundation area we found was to actively engage residents in building healthy, safe, equitable, and resilient physical, built, economic, and ecological conditions. Unsafe and unhealthy housing and transportation systems, as well as degraded local ecological systems, forests, watersheds, waterways, et cetera, and lack of family wage jobs really can create mental health issues. But when people get engaged in those activities and help restore them and regenerate them, we know, and the research shows unequivocally, that it enhances mental wellness, resilience, and it builds hope. It gets right to what Congressman Bacon talking about. This is vital. The fourth area is to engage residents in specific practices that enhance mental wellness and resilience. And there's lots of exciting ways to do that. We see one neighborhood resilience team has ways to engage residents in doing plays that make people laugh. So laughing often, practicing forgiveness, caring for the body, many different ways. And finally, the fifth foundational area is to engage residents in ongoing age and culturally appropriate and mostly peer-led group and community-minded healing opportunities. So up at the top, you see healing circles are one of these that are really, really important. Very different variations of healing circles where 5 to 100 people come together and share the distress they're feeling. They find out from others that, oh, they're feeling the same kind of thing, so they're not alone. There's nothing wrong with them. These are facilitated usually by trained peers. It reduces stigmatization. People learn about how trauma and toxic stress can affect them. They develop social support networks through that. All these factors are integrated, and you can see all the other different ways. And down at the bottom of the right-hand corner, you'll see that clinical treatment is still going to be important and part of it, but it's not going to be the dominant way simply because more than anything, there aren't enough clinicians to assist everybody. So these interventions show again that how community is medicine. Community really can be and is medicine if these are organized correctly. And a government has a very important role to play in these. Most importantly is to help establish the conditions for local resilience coordinating councils to be successful. And one key way to do that is to provide startup funding. It's very difficult for many of these community networks to get going. Even when they get going without any funding, they often peter out because people have other jobs, other responsibilities, as well as long-term fundings to support and help the resilience coordinating networks grow and expand if they attain their objectives. Government can also enhance the credibility of local resilience coordinating networks by publicly acknowledging them, which will increase their ability to engage more people and raise other types of funds. And they can also direct public agencies to participate in and coordinate their efforts with the local resilience coordinating council. And as you've already heard, that's what the Community Mental Wellness and Resilience Act of 2023 will do. It will authorize the Center for Disease Control and Prevention to establish a planning grant of up to $250,000 per year to help a resilience coordinating network get organized, establish a grant program of up to $500,000 a year to allow the expansion and growth of resilience coordinating networks. 20% of the funds are set aside for rural communities, which is very important. And also establish the CDC Technical Assistance Program to help community groups develop grants proposals, because they often don't have that capacity when they start up, and also to help the participants that are funded come together and learn from each other. So with that, I want to turn it over to a number of people who run these programs so you can hear from them about what their program is like. And I'd like to introduce Nevin Boyd, the Resilient Community Officer with the North Carolina Partnership for Children, Healthy and Resilient Communities Program. Nevin, it's all yours.
Thanks, Bob. Good afternoon. My name is Nevin Boyd. I'm the Resilient Communities Officer at the North Carolina Partnership for Children, NCPC, and I direct the North Carolina Healthy and Resilient Communities Program. I'm an advocate for organized groups and dedicated investments to advance community-wide wellness and resilience. I've seen what's possible, both as the director of a local resilience coalition and now providing support to coalitions across North Carolina. The Community Mental Wellness and Resilience Act of 2023 would help equip our nation to build thriving and healthy communities. I would like to express my gratitude to Representative Paul Tonko and all the other House and Senate co-sponsors of this legislation. Your commitment to advancing community mental wellness and resilience is commendable and forward-thinking. With generous support from Kate B. Reynolds Charitable Trust, NCPC has been supporting and learning from more than 50 county-level coalitions. Since 2019, there has been a dedicated position to work with these multi-sector coalitions who are bringing people together to address individual and community-level trauma and developing pioneering, innovative solutions to increase the well-being of their communities. Multi-sector means that more than one system, such as education, healthcare, law enforcement, is at the table. The state-level support to local coalitions that I provide with several committees has delivered on advancing our state's priority for trauma-informed and resilience-focused communities. We have worked with coalitions to develop a unifying framework for these efforts and co-created resources to build their capacity. Some of our deliverables so far include a data dashboard with resilience indicators, a survey to measure coalition culture based on SAMHSA's 6 principles of a trauma-informed approach, a robust statewide website with sector-specific resources, and a glossary to build shared language across the state. A variety of trainings requested by communities have been delivered, and we are currently backing 9 counties in their resilience training projects. Rather than waiting until after a disaster or trauma occurs, These coalitions proactively provide resilience and self-regulation skill training to residents, K-12 teachers and students, first responders, healthcare professionals, faith communities, and other essential groups. By prioritizing the well-being of those who serve our communities, these efforts have effectively reduced the trauma and stress load that workers encounter on a daily basis and have improved the quality of services delivered to residents. The Community Mental Wellness and Resilience Act of 2023 would provide funding to compensate local coordinators, ensuring consistency, relevance, predictability, and reliability. Paid coordinators serve as the backbone of efforts to break down silos between systems and organizations, fostering unified action and crucial conversations. We believe that local communities are best at identifying a community's unique needs and strengths, and therefore able to determine the most effective interventions. When communities are empowered and equipped to make decisions about themselves, they will make wise decisions, drive meaningful change, and stay engaged. Currently, most of the 50 communities in North Carolina are being coordinated by unpaid individuals who have added this to their already full workload. However, there are a handful of counties where coordination of cross-sector initiatives is a full or part-time job. It is unmistakably clear that those communities with paid facilitators are moving faster and more effectively than those without dedicated coordinators. The North Carolina Healthy and Resilient Communities Initiative wholeheartedly supports this legislation, and we implore Congress to swiftly advance it toward enactment. An excellent example of a community benefiting from a paid coordinator is New Hanover County. Tina Pearson, the director of New Hanover Resiliency Task Force, will now share her insights on the remarkable accomplishments achievable in a county with a paid coordinator. Thank you.
Thank you, Mevan. Tina.
I have to unmute myself so everyone can hear that I'm Tina Pearson and I am joining you from Wilmington, North Carolina. It is an honor to be here. And I want to take a moment to thank Representatives Tonko and Bacon and all of the other House and Senate co-sponsors for introducing the Community Mental Wellness and Resilience Act of 2023. It is exciting to see support for this bill, not only on both sides of the aisle, but also in both chambers. As Mevan mentioned, I am the director of the New Hanover County Resiliency Task Force. We are a real-life resilience coordinating network that would benefit from this legislation. Now, our task force was created in 2018 by a multi-sector group of community leaders passionate about helping children and inspired by the documentary Resilience, the Biology of Stress and the Science of Hope. Through their diligent efforts, especially those of our fiscal agent communities and schools of Cape Fear, funding was found to hire Mevan as our first paid coordinator tasked with developing the framework that serves as the foundation of our task force today. Over the last 5 years, membership has grown to include a steering committee, 8 subcommittees, and over 700 members representing over 100 organizations from every category listed in the CMWR. 55 of those organizations have signed our belief statement, expressing their commitment to working together to prevent and respond to the public health crisis caused by adverse experiences, trauma, and toxic stress. We all believe that by strengthening connections, educating community members, and inspiring people to take action, we can build a compassionate and resilient community where everyone can thrive. Now, an example of task force members taking action can be found in our own New Hanover County government. They have embedded resiliency training into onboarding for all of their employees. Sadly, the need for this training became evident during Hurricane Florence and its aftermath. While southeastern North Carolina has certainly had its share of hurricanes, Florence's slow departure, record-breaking rainfall, and severe flooding resulted in real-time trauma, not only for residents, but also for county employees tasked with emergency and disaster response, even if it wasn't part of their regular duties. I want you to imagine being a librarian, tasked with helping people out of a helicopter after their rooftop rescue, while also worrying about your own loved ones and home. Officials recognized it was imperative for county staff to understand how to regulate their own nervous systems to protect their health. And not long after, with the additional community trauma of COVID, it became evident that the task force needed to do the same for teachers, healthcare providers, first responders, and others who needed to know how to take care of themselves so they can better take care of the people they serve. Now, other task force initiatives include, but are certainly not limited to, training community members to be community resiliency model and reconnect for resilience educators, helping New Hanover County schools launch a trauma-informed schools pilot, serving as an NC Child Advocacy Network hub, and providing trauma and resiliency training to over 6,000 people. The success of the task force has been exponentially greater because of having a paid coordinator working full-time to coordinate meetings, engage in community outreach, manage projects, and facilitate training. And the workload has even been large enough to warrant an additional staff member. And I am honored to work with Javane Skiba, our Assistant Director for Equity, Education, and Engagement every day. Now, while we have been fortunate to find enough funding to sustain us, it is challenging to find sustainable funding. Each year, it seems harder to find grantors who can see the service we provide as coordinators in the same light as other direct services. However, the need for community-based resilience coordinating networks continues to grow. As already mentioned, local communities are best equipped to identify their unique needs and determine the most effective strategies to address them. Most of the existing networks are relying on the passion of individuals who are adding to their already full-time work responsibilities, extending their workdays, or even volunteering their own time. And the need to address adversity and strengthen protective factors is urgent, and we cannot afford to continue to rely on part-time, essentially volunteer efforts. That's why we wholeheartedly support the Community Mental Wellness and Resilience Act, not only for ourselves, but our fellow communities. Again, thank you for this opportunity. Thank you for this legislation, and thank you for listening.
Thank you, Tina. Now I'd like to introduce Becky Turner, Director of Community Engagement with the Community Resilience Initiative in Walla Walla, Washington.
Thank you, Bob. I'd like to start by thanking the representatives for introducing this important legislation into the House. And I'd also like to thank the senators for introducing the companion bill into the Senate. My name is Becky Turner, and I am the Director of Community Engagement for the nonprofit organization Community Resilience Initiative, which I'm going to refer to as CRI. We're located in Walla Walla, Washington, which is a small rural town in the southeastern corner of the state. CRI is committed to creating a citizenry conversant in the science of trauma and resilience. We help communities and individuals prevent trauma and heal from trauma by sharing science-based insights in order to promote and cultivate resilience. We believe that what is predictable is preventable, and that resilience helps us overcome adversity. We've organized a robust network of coordinating service providers in Walla Walla, which includes public and private schools, the medical community, government, and nonprofit agencies that provide a wide range of social services. CRI also provides trauma-informed and resilience-based training and education to folks nationwide. Last year, in 2022, we trained over 1,000 folks and an additional 700 in Washington state alone. Our work was featured in the documentary Paper Tigers, and we've shown through research and data that providing strength and resilience-based programs can positively impact graduation rates, decrease violence, it can decrease the impact of mental illness, and it can create a meaningful sense of community. Walla Walla is built around agriculture, and we have seen our fair share of extreme weather events. In February of 2020, less than a month before the lockdowns, our area experienced catastrophic flooding that damaged infrastructure and threatened the livelihoods of our farmers and our local economy. Later that same year, in September of 2020, our area briefly held the world record for the worst air quality as a result of smoke from nearby wildfires. The smoke lasted for weeks. In June of 2021, Walla Walla experienced an unprecedented heat dome that resulted in the widespread crop loss of our famous Walla Walla sweet onions. Extreme weather has damaged our wellness, our mental health, and our economy, and we need the tools to build resilience. CRI believes that resilience trumps adversity, and that by building community-wide resilience, we can buffer against the harmful effects of situations that are often out of our direct control. We help build resilience by connecting community members to services they can use, by teaching folks about neuroscience and the long and short-term effects of trauma, and how to increase resilience on a personal and community-wide level. We believe that community is the solution. The Community Mental Wellness and Resilience Act of 2023 would help my organization provide critically important information to folks who can use it most. The people who are suffering from the flooding, the people who are suffering from the crop shortages, the drought, and other weather-related traumas. We don't control the weather, but we can control our response to the folks that are affected by it. The Community Resilience Initiative urges Congress to swiftly enact the Community Mental Wellness and Resilience Act of 2023. Thank you for your time, and I will turn it over to Virginia's Trauma-Informed Community Networks.
Thank you, Becky. And I want to introduce Charlotte Ure, coordinator of Virginia's Trauma-Informed Community Networks. Charlotte?
Good afternoon. I'd like to start with a heartfelt thank you to Representative Paul Tonko and all the other co-sponsors in the House and Senate for introducing the Community Mental Wellness and Resilience Act. My name is Charlotte Ure, and I'm joining you from Richmond, Virginia. I serve in dual roles as the Community Programs Impact Specialist for Greater Richmond SCAN, a nonprofit dedicated to the prevention and treatment of child abuse and neglect, and as the coordinator for Virginia's Trauma-Informed Community Networks, or VATICNs, a coalition of 32 trauma-informed and community resilience networks, the first of which was formed in Richmond in 2012. These networks build bridges across sectors, bringing professionals from healthcare, schools, courts, and on together with families, faith leaders, and community members to mitigate and prevent trauma and improve the mental health and overall well-being of all those in the regions they serve. Each network is unique, led by and serving the needs of community members across a diverse spectrum of lived and professional experience. Networks provide trainings, education, events, and resources, and are a hub for connection and community healing. For example, our network in Greater Richmond has provided free introductory trainings on trauma and resilience to over 10,000 individuals, with participants reporting an increase in knowledge on strategies for building resilience that they can bring back to their families, schools, and organizations. Our networks plan and lead Resilience Week Virginia since 2020, a week during Mental Health Awareness Month in May, where we celebrate the strengths and accomplishments of our communities and prioritize building relationships and community care. The Governor of Virginia has signed a Resilience Week proclamation every year, drafted by members of Virginia's TICNs. We have cultivated strong partnerships with state departments, including Virginia Department of Social Services, Virginia Department of Health, and the Department of Behavioral Health and Developmental Services, who recognize the TICNs as an evidence-based prevention strategy. In 2021, I worked with the Governor's Office to organize community conversations between then First Lady Pamela Northam and 18 of our network coordinators, where they were able to share their many accomplishments, as well as the challenges and needs still existing in their communities to help inform the incoming administration. The vast majority of individuals who are building, coordinating, and supporting these networks are doing it as volunteers or as part of their many other responsibilities in their roles within nonprofit or government agencies, just as I am. I've heard time and again the need for funding to support our efforts, to be able to pay staff dedicated to this work. We know the prevalence of trauma throughout our communities, and the workforce is no exception. We have seen a great deal of turnover amongst frontline workers and those in helping professions. Many of our networks serve rural areas that are underserved and under-resourced. Despite all of these barriers, network leaders continue to show up and persevere to provide positive childhood experiences for young people in their communities, to spread awareness about how to build resilience across the lifespan, and how to build relationships that will sustain us and prevent further traumatization. These services take a tremendous amount of time and care. The Community Mental Health and Resilience Act would provide much needed funding to support and expand this incredibly important work. Funding that would ease the stresses for those on the front lines, for those working behind the scenes, and for everyone in the community who benefits from the invaluable services our networks provide. On behalf of Virginia's trauma-informed community networks, I strongly endorse this legislation and urge Congress to move to enact it. Thank you so much for this opportunity and for your time and consideration.
Thank you, Charlotte. I'd now like to introduce Robin Sanger, the founding director of Peace for Tarpon in Tarpon Springs, Florida. Robin.
Thank you, Bob, and thank you for this opportunity. I'm Robin Sanger, founding director of Peace for Tarpon in Tarpon Springs, Florida. Peace for Tarpon began in 2010, making Tarpon Springs the first trauma-informed community in the United States. I came to this work while serving my community as vice mayor when I began to notice that in spite of the many efforts to curb and reverse our most challenging issues, we really didn't seem to be gaining much traction. That's when I learned about the ACE study and how unaddressed childhood trauma can play out throughout a lifetime, impacting individuals, families, and communities. That changed everything for me. In the beginning, our focus was mainly education about trauma, what it is and its effects, but our understanding grew over time as we learned the powerful role resilience plays and realized the power of a resilient community. We too see community as medicine. We know that healing happens in community. The 4 in Peace for Tarpon stands for connect, inform, transform, and heal, and all that we do aligns with one or more of those goals. In our first 5 years, although we had a few $1,000s of seed money, we received over $1.5 million from pro bono and in-kind donations. That generosity demonstrated how much the community supported our efforts and embraced our motto, which asks everyone to contribute their unique piece to our work. The number of community member partners grew, and with it, their engagement and support. Our first partner was the city of Tarpon Springs, and we steadily expanded our reach to include the schools, our police and fire rescue, businesses and nonprofits. But as we came to understand, our most devoted and valuable partners were and still are our residents. We respond as quickly and nimbly as possible to community needs as they arise. Through our many connections and partners, we've become very skilled at that. All of our offerings are free of charge and include many trainings as well as community events. Here's a few examples. At the request of our police chief, we have provided trainings for our first responders, followed by a training for loved ones of first responders. We hold a yearly education leaders breakfast at our St. Petersburg College campus. Educators from early learning through college can meet and get to know each other while learning how to become more trauma-informed and resilient in their work. We've had many trainings through our mental health provider partner, Suncoast, to educate parents and caregivers how to keep their kids safe from sexual abuse as we work to lower the rampant numbers of our children who experience that. 1 in 2 or 3 girls and 1 in 3 or 4 boys is what the data is showing us. Recently, we responded to the request of our middle school principal to reach out and engage with students and parents. We will be holding a community conversation at our rec center called Coming Together for Change to learn where misunderstandings begin, how to resolve conflicts, and how to let go of past hurts to start this school year out on a positive note. These are just a handful of examples. Over the past 13 plus years, Peace for Tarpon has initiated, coordinated, sponsored, and delivered dozens of significant trainings, community events, and programs. We are a trusted community asset, and it's significant that our accomplishments are as an all-volunteer organization. The requests of us are steadily increasing. The Community Mental Wellness Resilience Act of 2023 is a perfectly timed response. It will provide the much-needed support we need to grow and move forward. We're asking for your support for the growing number of communities across the nation inspired to build their own trauma-informed and resilience-building initiatives. In Florida alone, there is Peace for Tarpon, Peace for Gainesville, Sarasota Strong, the River Phoenix Center for Peace Building, Peace for Minnesota, Peace for the Big Bend, and just recently, PACES Hillsborough. Sometimes we're at the epicenter of just the right moment for something to emerge. And the time is now to support the hard work of your constituents in your hometowns and home states and to pass the Community Mental Wellness Resilience Act of 2023. This would support what is the most important work of our time. Your support could be the tipping point that changes everything. We are all counting on it. Thank you.
Thank you, Robin. Thank you all for your comments. I just want to summarize, and then I want to have you all hear from a few of the leaders at the national level. First of all, only a few of the initiatives you heard from and only the few of the community mental wellness and resilience initiatives around the country frame their work as a public health approach, but they're all using variations of it. And none address all the five foundational areas our research identified, and that's because each is unique. They are all organized to address the issues, needs, and demographics of their community. There is no one-size-fits-all approach. But if the existing initiatives are strengthened and thousands of new ones, our community initiatives are launched nationwide in every state across the nation, we can reduce today's mental health epidemic and prevent new ones. And with that, I like you to introduce a number of people that will just briefly share their organization's perspective on this. The first is Dr. David Shern, Senior Public Health Advisor with the National Association of State Mental Health Program Directors. David?
Thank you, Bob. It's great to be with you. And like everyone else, I'd like to extend my thanks to the representatives who have had the foresight to help support this legislation. I actually represent several groups in a sense. I'm a founding board member of the Campaign for Trauma-Informed Policy and Practice, which is a national 501c3 private nonprofit organization that seeks to build trauma-informed communities and to work to support policies that also support these kinds of initiatives. I'm the former president of Mental Health America, which is the nation's oldest and by some measures largest advocacy group for all things having to do with mental health and mental illness. And then finally, and relevant for today, I'm a senior public health advisor at the National Association of State Mental Health Program Directors, NASHPD. NASHPD is a professional association that represents all of the state mental health authorities throughout the United States and the territories. So Ann Sullivan, Representative Tanco, is the commissioner in New York, and Sherry Dawson, Representative Bacon, is the commissioner, the former commissioner actually, in Nebraska. So we represent their interests. And as everyone has said to this point, the state mental health authorities are seeing profound increase in terms of need for both mental health and substance use services. As Representative Bacon underscored, at the same time, they're confronting workforce shortages, which are quite daunting. And I think that they're increasingly becoming convinced that we are not going to treat our way out of the situation, and we need to move upstream, both by earlier intervention for people who are developing problems, but really, I think very importantly, by strengthening community linkages in the way that our excellent representatives from the programs have so nicely articulated. So that's why the Community Wellness and Resilience Act 2023 is so important, because it really seeks to get to the root of these problems related to toxic exposure to toxic stress and to build resilient and mentally healthy communities. That's the way we're ultimately going to be able to address these issues. So with that, I'll turn it back over to Bob and the next national representative.
Thank you, Dave. Now I'd like to introduce Sarah Butts, the Director of Public Policy at the National Association of Social Workers.
Thank you so much, Bob. It's so inspiring to be here. I just have to say, to see the sheer volume of participants today. We want to thank our congressional champions in both chambers on this proposal. In addition to being the director at NESW, I'm also a proud social worker myself. NESW is the largest social work association in the world. We have about 110,000 members nationwide, and we represent the interest of over 750,000 social workers in the country. We're an essential workforce on the front lines as mental and behavioral health professionals. We work across many different settings in and among the community. Social workers are there to provide services to patients and clients during some of life's most difficult moments. When patients experience birth, when they're experiencing a health condition like cancer or grief after the loss of a loved one. Sometimes less understood, we are also there for disaster response and relief, working with individuals and families who are directly impacted by extreme weather events like floods or hurricanes, or when other adversities occur. Think about when families are separated, or when people become homeless or displaced. When something is wrong, social workers are often called in to assist. In social work, we recognize that the social is fundamental. And what's so tremendous about this bill is that it also recognizes that our communities, as Bob said, can be medicine. This is a very positive, proactive, and innovative approach. And the reason why NASW's endorsed the Community Mental Wellness and Resilience Act is because we know that this proactive, strengths-based, prevention-oriented, and whole population approach is needed to address the challenges that we are facing. Our current healthcare and behavioral healthcare workforce and system structure cannot effectively respond to the large-scale crisis alone and without the strengths and talents of our communities. We believe that communities know how to help develop the solutions that are good for them and work for them, and to pool their resources. We need this investment to improve our response capacity and to deploy a prevention strategy, like I said, that's innovative. And we commend our congressional leaders for taking this challenge on. And we hope that all of you on the line will help us to recruit additional co-sponsors on these proposals. So with that, NASW strongly endorses the bill and urges Congress to move it quickly to enactment.
Thank you,
Back
Sarah.
to you, Bob.
Thank you, Sarah. I'd like to introduce Catherine Catalano, the Deputy Director of the Center for Climate and Health Equity at the American Public Health Association. Catherine?
Thank you, Bob. I also really appreciate being here today and hearing from everyone on the call. Very appreciative of the congressional champions that are sponsoring and co-sponsoring this legislation. I'll just highlight that community level solutions and treatment options will be necessary to address America's growing mental health epidemic. Our mental health, human services, and disaster mental health systems cannot assist all the people who experience mental health problems today, and this gap will only grow over time. In addition, many people will not engage in traditional mental health treatment due to high costs or fear of being stigmatized, among other reasons. In 2021 alone, more than 1 in 5 American adults experienced a diagnosed mental illness, and more than 150 million people live in federally designated mental health professional shortage areas as of 2022. Within a few years, the country will be short between 14,000 and 31,000 psychiatrists, and psychologists, social workers, and others will be overextended as well. This truly is an epidemic. Using a public health approach to address mental health and wellness at the community level is critical, as adults and children across this country are collectively dealing with population level traumas from things like rising violence, housing and food insecurity, COVID-19, and natural disasters. The Community Mental Wellness and Resilience Act of 2023 would empower communities through a new federal grant program to craft their own locally specific responses to the mental health problems caused by disasters and other toxic stresses in their communities. So the American Public Health Association strongly supports this legislation. Thank you.
Thank you, Catherine. Now I'd like to introduce Ruben Cantu, the Director of Safety and Wellbeing Team at the Prevention Institute.
Thanks, Bob. Good afternoon, everybody. I'm Ruben Cantu with Prevention Institute. A huge thank you to all of the House and Senate sponsors and co-sponsors for introducing this legislation, and to Bob for his work to support this effort. Prevention Institute's a national nonprofit organization based in Oakland with offices in LA, Houston, and Washington, DC. And our mission is to build prevention, health equity, and racial justice into policies and actions at the federal, state, local, and organizational level to make sure that the places where people live, work, play, and learn foster health, safety, and well-being. And an issue of increasing importance to the communities we work with is the rising incidence of extreme weather events and related mental health concerns. A recent project we conducted for the CDC on suicide and trauma prevention in the face of infrastructure disruption highlighted that longstanding racism and the harms caused by catastrophic events create significant strains on mental health and exacerbate risk factors for suicide and childhood trauma, including job loss and financial stress, social isolation, and access to healthcare. As communities address these mental health challenges in response to these kinds of events, we need systems that apply a racial equity lens, that recognize and address the impacts of community trauma, that center community healing, that address community conditions, and that strengthen partnerships between communities and local governments. Our partners realize that mental health services alone won't prevent or heal the rising stresses and traumas related to these concerns. Giving local residents and community members the opportunity to heal and to get actively involved in changing the conditions around them that will exacerbate harm will have an immense impact on their well-being. The funding and technical assistance provided by the Community Mental Wellness and Resilience Act of 2023 will support local strategies that strengthen resilience and enhance protective factors that help prevent and heal mental health, behavioral health, and psychosocial problems. For those reasons, we endorse the Community Mental Wellness and Resilience Act of 2023 and urge Congress to move quickly to enact it. Thank you.
Thank you, Ruben. And lastly, I'd like to have you hear from Dr. Joshua Wartzel, who is the chair of the Committee on Climate Change and Mental Health with the American Psychiatric Association. Joshua?
Thank you, Bob. Good afternoon. My name is Dr. Josh Wartzel. I'm a psychiatrist, and as Bob said, I serve as the chair of the American Psychiatric Association's Committee on Climate Change and Mental Health. The increasing rate and severity of natural disasters is undeniable, and they unfortunately carry significant mental health consequences. Heat waves and warmer temperatures are associated with higher rates of suicide, violence, and mental health hospitalizations. Droughts, floods, wildfires, and hurricanes directly contribute to psychological trauma, and these are associated with increases in substance use and domestic violence. Many Americans who have not yet faced such natural disasters are experiencing what we call climate distress, a range of psychological responses including fear, anger, and grief about natural disasters and effects from them that they expect to soon face. Natural disasters know no race or class. They produce physical and mental health effects, economic disruptions, housing and food insecurity, forced migration, and other challenges for everyone they touch. But those who are already more vulnerable, including children and those economically and racially marginalized, often face the greatest obstacles in addressing and accessing the resources to recover. There are unfortunately not enough mental health providers to assist everyone in need. 47% of Americans live in regions with a shortage of mental health services. We need the creative community-level strategies that the Community Mental Wellness and Resilience Act will foster and support in face of acute and long-term disruptions from natural disasters. This is an essential step to strengthening the mental health of our country. On behalf of the American Psychiatric Association and the greater community of psychiatrists, I would like to thank our congressional champions for their leadership in introducing this bill. We hope the Congress will consider this important legislation at the earliest opportunity. Thank you.
Thank you, Joshua. I just want to do a quick summary now, and that is that the Community Mental Wellness and Resilience Act of 2023 is landmark because it will expand the U.S. approach to mental health by actively engaging communities and using a public health approach to help to build the capacity of residents for mental wellness and resilience to prevent and heal all types of traumas. And the benefits will be far-reaching. They'll protect the health, safety, and well-being the wellness and resilience of mental health, human services, social work, physical health, and community safety providers, fire, police, and other ones. It'll enhance employability and safeguard local businesses and the economy. And it will build the social efficacy and common purpose needed in our communities to address today's common challenges. If your organization supports the legislation, we urge you to contact your member of the House or Senate members to state your support and urge them to swiftly enact the legislation. Please tell your members and partners about the legislation and urge them to contact the House and Senate members also to encourage enactment. You can also add your name to the over 150 national, state, and local organizations that have already endorsed the Community Mental Wellness and Resilience Act. And you can go to the ITRC website for information on how to do all of that. It's itrccoalition.org. So I want to thank you all for attending today's congressional briefing. If we didn't have time for questions, but please send questions to tr@trig-cli.org. We can then distribute them to different people if you have questions for different organizational members that you heard from. We encourage you to get more informed about this and to really try to support and encourage Congress to enact this legislation as quickly as we can. So with that, I want to thank everyone for joining us today and all the speakers and especially the 2 members of Congress who joined us. And I wish you all the best on this, all of the good work you do. Thank you all for joining us. Take care.